Hi guys, today's topic about peritonsillar abscess or Quinsy. What is Quinsy? It is pus collection or abscess formation between the tonsillar capsule and tonsillar bed, mostly between the superior constrictor muscle and tonsillar capsule. So this is commonly seen in the male patient between 20 to 40 years of age. If you compare this, while tonsillectomy is common between, this is Quinsy is common age group, while acute tonsillectomy, acute tonsillitis is common between 5 to 15 years of age. This acute tonsillitis is mostly bilateral, while this Quinsy is mostly unilateral. So, what is predisposing factor? Predisposing factors are age between 20 to 40 years of age, smokers, immunodeficiency like diabetes, tobacco chewers, tobacco chewers, male patient. So these are the predisposing factor for Quinsy. Now, what is pathogenesis? There are two theories for Quinsy formation theories. First is acute tonsillitis. Acute tonsillitis theory, according to that, if patient having acute tonsillitis, then that spread into the pericapsular area, and this pericapsular area lead to peritonsillar abscess or Quinsy. So first theory is acute tonsillitis leading to Quinsy. But controversy of this is that 60% of the patient of Quinsy does not present any pre-existing history of acute tonsillitis. So these 60% are cases from the idiopathic, or you can say coming directly with unilateral presentation. Unilateral presentation. It means this acute tonsillitis most of the time is the bilateral presentation with age group between 5 to 15 year of age, while this Quinsy is between 20 to 40 year of age or mostly unilateral. So this theory is less accepted. Second theory is blockage of Weber's gland given by Passy. Passy. This is Passy theory. Blockage of Weber's glands. What are the Weber's gland? Salivary gland, which are situated minor salivary glands, minor salivary glands, which are situated in the upper pole of the tonsil behind the antetonsillar pillar or junction of antetonsillar pillar between the soft palate. So these minor salivary gland duct blockage leading to infection of this peritonsillar area, means between the superior constrictor muscle and this capsule. So this theory, according to that, blockage of Weber's glands. What are the Weber's gland? Minor salivary gland which are situated in the upper pole of the tonsil is called Weber's glands. What is function of this Weber's gland? Clearance of this area, mucociliary clearance and secretion of saliva is the function of this Weber's gland. So this theory is more accepted and it's also considered as idiopathic development of the peritonsillar abscess or Quinsy. So these are the two pathogenesis. Now, what are the types of Quinsy? Types of Quinsy. Quinsy is two types. Type 1 according to Powell et al. According to Powell et al., Quinsy is two types. Type 1 is most commonly because of anaerobes. Anaerobes types because of group A beta hemolytic streptococcus. That is Streptococcus pyogenes. So this is the most common organism which lead to this is aerobic. Aerobic type is type 1, that is GABS or Streptococcus pyogenes, that is mostly mild to moderate type. Mild to moderate type. So first type is aerobic infections. Aerobic. Aerobic infection mostly by GABS or Streptococcus pyogenes leading to mild to moderate presentation of the Quinsy. Second type is anaerobic infection or polymicrobial infection. Polymicrobial infection, which is combined with Streptococcus pyogenes plus Fusobacterium or Peptostreptococcus. It means type 1 is aerobic infection or single organism infection is called type 1. Multiple organism or mixed with anaerobic infection is type 2. It is mostly added by Fusobacterium necrophorum or Peptostreptococcus. While type 1 is single organism, most commonly Streptococcus pyogenes. This type 2 is severe infection or polymicrobial form. While this type 1 is the single organism infection according to Powell et al. Now, what is the clinical feature? Clinically, clinically, if you see clinically, most common presentation is unilateral sore throat with dysphagia. This is the common presentation. What is Quinsy triad? Quinsy triad. Quinsy triad is if there is trismus plus hot potato voice, or you can say muffled voice, muffled voice plus uvular shift. Enteromedial shifting of the uvula to the opposite side. Hot potato voice and trismus are classical presentation of the Quinsy. This is called Quinsy triad. Means trismus, hot potato voice, and uvular shift is the Quinsy triad. Now diagnosis. Diagnosis of Quinsy is mostly clinical. It is almost always is clinical. You can add CECT in cases of if you see suspicious of any mediastinal extension or parapharyngeal or retropharyngeal extension, then you go for CECT. Now, what is the management of Quinsy? Management. After confirming that it is the Quinsy, then you can go for needle aspiration. Where you do this needle aspiration, so if you see, this is the tonsil and this is the superior constrictor muscle and this is uvula. So what is where we have to do needle aspiration? Most commonly, it is done at the most bulge part of the superior pole. Means there is maximum bulging, you can do needle aspiration using 18 number needle, 10 cc syringe. Just you have to pierce this needle at the most bulging part of the superior pole. If there is not any bulging part of the superior pole, then you can do it about that base of the this uvula and junction of anterior tonsillar pillar. Then you can pierce here. Second one, if you don't find any bulging point, then you can do aspiration at this side, base of the soft palate or uvula and that anterior tonsillar pillar. Then you can do needle aspiration. But it is done on most bulging part. If bulging part is there, then you can do surgery, IND, incision and drainage. There is in some studies there is no difference between needle aspiration and incision and drainage, but this is called gold standard treatment. Gold standard treatment because there are chances of complete aspiration of the pus, while in needle aspiration some pus may be left, but both are equally effective. So incision and drainage is gold standard treatment. Now, third treatment is immediate tonsillectomy, or you can say this abscess tonsillectomy. A patient having a history of recurrent Quinsy, then you immediately under GA you can go for immediate or abscess tonsillectomy. This is called abscess tonsillectomy because there is no difference between interval and immediate this abscess tonsillectomy. It is quite effective. You see there is already plain is there. There is pus and you have to dissect this tonsil at the acute penetration of Quinsy. That is very easy in this Quinsy because already plain is there. So this is called immediate tonsillectomy or abscess tonsillectomy. Antibiotics should be given. What are the antibiotics? Amox, amoxicillin with clavulanic acid plus metronidazole. This combination is better. Or you can give ceftriaxone, ceftriaxone, third generation cephalosporin plus metronidazole. This is the therapy of choice. Amoxicillin clavulanic acid combination with metronidazole or ceftriaxone with metronidazole is the therapy of choice in Quinsy cases. Now, what is tonsillectomy in respect to Quinsy? First is called immediate or abscess tonsillectomy. If this tonsillectomy done at the time of presentation of the acute presentation of Quinsy, then it is called abscess tonsillectomy. Immediately, when you are doing incision and drainage, same time you can go for tonsillectomy. Second is called interval tonsillectomy. In this, you are doing tonsillectomy after settle down of this abscess after 4 to 6 weeks. This is called interval tonsillectomy. Now, other terms related to this are the one is called hot tonsillectomy. Hot tonsillectomy. Hot tonsillectomy means you are using hot instrument to doing the tonsillectomy like laser and diathermy. Diathermy and laser are called hot tonsillectomy. What are the cold tonsillectomy? Cold tonsillectomy means you are using cold instrument like dissection method is called cold tonsillectomy. Third one is cold hot tonsillectomy means mixed tonsillectomy. Cold hot tonsillectomy, it is combination tonsillectomy because temperature is less and its temperature is higher than the cold method. Then combinator tonsillectomy is also called cold hot tonsillectomy. So this is all about Quinsy. Thank you so much.